Dr. Lee, you wanted to say something.
Dr. Lee, if I can make a few words and don't bow me down here. Okay. Any healthcare reform discussion should start off with the patient first. We're all patients. Number two, when our President Barack Obama is stepping forward and step up to this, he's not big government and he's not socialized medicine. Senator Kadar has said it is not easy to discuss healthcare because there are so many stakeholders, and under the American system of capitalistic, everybody is trying to make a buck, and that's fine because there's economy. So therefore, how can we all work together and don't throw the baby out with the bathwater? And I feel that there are few low-hanging fruits that both the insurance company, who has to make money, that's your job. If you lose money, they fire you, okay? And that's not bad, okay? What are the low-hanging fruit? We have so much. I'm a physician, a professor at your university, and healthcare reform. We have very fragmented and disjointed care. If we just save that, we will save $200 and some billion a year. And how do we do that? Two things very simple. Electronic medical records or health record to coordinate care. Right now, if you have 20 doctors, your records are scattered over 20 places, and the dumb, stupid doctors think we can't get it. We call the secretary, fax it, it doesn't get here for 6 weeks. Why? I don't know. Okay? But anyway, but there's a problem with electronic medical health record because the technology as of today is so expensive and is so cumbersome that you become, young doctors, a data entry clerk instead of keeping the emotion of looking eye to eye with you. But the technology is here, thanks to Dr. Blumenthal, brother, where it's web-based like President Obama wants, it's interoperable, it's user-friendly, and it's inexpensive, less than $10,000 per practice, not $50. So we need to bag Nancy Ann, I just learned that one, Nancy Ann, to implement this new technology, not the one that is of yesterday. And the second is primary care doctor, where we should have a quarterback doctor, where everybody, I serve as a quarterback doctor for my relatives, my children, and for my neighbors. I'm an ENT, but they call me for the kidney thing. They're calling from the OBGYN, but I know who to go to. If you ask Pat Shamel or any doctor in this hospital, if you were sick, who is the best doctor, best outcome, best customer service, most cost-effective? We know. But it's not in the data that you can know. We should put in the data so they can know. So they have low-hanging fruit to get rid of disjointed care, fragmented care. Once we make the money, don't spend the money first. Once we make the money by lowering, then we can move forward, and a public plan to compete on an equal footing with insurance companies is good. The Republicans and all the others, or the conservatives, are dumping on the public plan that they're trying to do, okay? Calling it unfair competition. Now, if the public plan is to charge a premium cheap, okay, and once we get rid of the insurance company and raise the premium like in business do, that's bad. But on the other hand, if the public plan is just to help poor people who cannot afford it to have health insurance and have choices for the ones who wants to drive Cadillac, I drive a Honda. Okay? So I think that commonality, we can all pick the low-hanging fruit instead of killing each other. Yeah.
There's a lot of persuasive people here. Senator or Congresswoman, I couldn't say it better, and President Obama, I think, agrees with everything you said.